I'm Dr. Walks. I'm a cardiovascular surgeon here at Texas Heart and Vein Multi-Specialty Group, and we've decided that you are in need of having an abdominal aortogram, which is a test that looks at the blood flow in both the abdomen as well as down your legs. And the reason we do this test is to identify whether or not you have any blockage in the arteries in the legs, causing either pain or a wound in your legs not to heal properly. So what to expect as a patient is the night before we're going to ask you to not eat any food after midnight. You're going to come into the office the next day or to meet us in the hospital, and you're going to go into the cath lab to have the procedure performed. At that time, the staff in the cath lab is going to put you on our table. They're going to prep your groin areas, and then what we're going to do is we're going to actually go in the femoral artery on the opposite side that we're actually treating. So for example, if you have a wound in your left leg, we're actually going to go in your right groin or the right groin area to get access to the artery on that side. Then we're going to go up and over and squirt dye to show us what the arteries in your leg looks like on the opposite side. So again, for the left side, we're going to access your artery on the right side. Then we're going to squirt dye down the arteries in the left leg, and it actually gives us a road map so that we can see exactly where the blockage in your leg is. After we see where the blockage is, we're going to determine how the best to treat you, whether it's using a balloon to open up the blockage, a Roto-Rooter, just like you would clean out the pipes in your home that have kind of grunge in them, or a stent, which is kind of something that we like to do as a last resort, because once we put the stent in there, there's no way to take that stent out. When you're finished with the procedure, you're going to go to the recovery area and you're going to spend a few hours while we make sure that everything looks good, your vitals are going to be monitored, and then we're going to let you go home with the idea that if anything strange happens to you, based on the set of directions that we give you, you give us a call. Otherwise, we'll see you back in our clinic in a week or two, at which time we'll do a post-procedure arterial Doppler to look and make sure that everything that we treated is open, and that's kind of how we'll follow your disease progression over time.